Thank you, Chairman Teaberry, and thank you so much for holding this incredibly important and timely hearing. Thanks to our panel for being here today. Addiction to both heroin and prescription opioid pain relievers is a public health epidemic that is devastating families and communities across our nation. Every day, 91 Americans die from opioid overdose. Overprescription is partially responsible for this epidemic. Since 1999, the amount of prescription opioids sold in the U.S. nearly quadrupled, and so too has the number of overdose deaths from opioids. The economic costs of that addiction are incredible, totaling more than $80 billion in 2013 from increased healthcare costs, higher rates of incarceration, and lost productivity. New Mexicans know all too well the devastation that heroin and prescription opioids can wreak. For years, without adequate treatment resources, communities in New Mexico have suffered through some of the highest rates of opioid and heroin addiction and overdose deaths in the nation. Rio Arriba County has a drug overdose death rate of 81 per 100,000, 5 times the national rate. I am reminded of a young man named Josh from Española who I met at a roundtable I hosted last year in Rio Arriba County. At 14, Josh became addicted to prescription opioids. Over time, he moved to heroin. He stole from his family and his friends to maintain his growing addiction. Josh spent time in jail where he went through the pains of withdrawal. He even attempted suicide. Now in his 20s, Josh has turned his life around because he finally got access to treatment and services. For millions of Americans, proven substance use treatment is available because of 1, behavioral health parity laws, and 2, the Medicaid program. In New Mexico, Medicaid, called Centennial Care, is at the forefront of our fight against the opioid crisis, accounting for 30% of life-saving medication-assisted treatment payments for opioid and heroin addictions. At exactly the time that Congress should be giving states more tools to fight this epidemic, House Republicans passed a bill that would repeal Medicaid expansion, artificially cap the program, and shift the burden about who and what to cut onto individual states. More than 1 million people who have been able to secure treatment for substance abuse would lose their coverage. Repealing Medicaid expansion would cut about $4.5 billion from treatment for mental health and substance abuse. We cannot fight a public health crisis with grant dollars alone. Grant dollars run out, block grants lose their buying power over time, and private investment dollars, which are critical in this fight, won't come without certainty that the foundation is funded. Unfortunately, I will not be able to stay here to hear the important testimony of our witnesses today because of a hearing you may have heard about in the Intelligence Committee, but I will be leaving you in the very capable hands of my colleague, Senator Hassan. New Hampshire loses at least 1 person every day to a drug overdose. As governor, Senator Hassan used every tool at her disposal to fight the epidemic, including turning to the flexibility of the Medicaid program to gain ground in her state's fight. I'll let her tell you more, but I leave you with this. When a community faces a public health crisis, it's not long before a state turns to the Medicaid program to stem the tide. Thank you, Senator Hassan. I will turn over the rest of my time to you, and thank you, Chairman, for holding this critical hearing.